Hello, everyone. My name is Vanessa Adams. I'm the program coordinator of Kids Mental Health Pierce County, a community coalition of agencies and providers working at supporting youth and families here in Pierce County with accessing behavioral health, mental health resources, supporting mental wellness. I'm here with Jasmine Martinez and Jordan, who are going to be talking to you and talking to me and helping us all learn a little bit more around peer support specialists and the importance of adding peer and parent supports to care teams. So I'm going to pass it over to Jasmine Martinez from a Common Voice COPE project to kick us off. We'll have a couple other panelists joining us, and we'll just go ahead and get started with Jasmine.
Great, thank you so much. I'm going to go ahead and screen share. Oh, may I screen share, Vanessa?
Yes, I'll give you permission right
Thank
now.
you. So yes, my name is Jasmine Martinez, and I am program manager for a Common Voice COPE project. For those of you who don't know, a Common Voice began in 1995 in Pierce County. Our founder is Marge Critchlow, and she named the Common Voice because she wanted families, parents, and caregivers to find their voice again in the midst of advocating with and for their children. And so that is how our name came to be. About 2 years ago, we were given a contract through Washington State Healthcare Authority to take that grassroots foundation statewide. And so now we're able to offer support across the state of Washington. And so I'm going to go ahead. I'm not going to go into detail with these slides, but I wanted to at least share a bit about us with you. And so now we are a Common Voice COPE project, otherwise known as the Center of Parent Excellence. And so I like to start with this picture here that I've titled On the Other Side, and it kind of digs into a little bit what parent partners or lead parent support specialists do. And I know that's what's in part with this or what this entire webinar is about. And so this is actually a picture of myself. My son has accessed about four WISE teams across 3 different agencies. He's also accessed DDA, Social Security, IEPs, inpatient psychiatric treatment, inpatient medical treatment, and ultimately accessed 22 months of children's long-term inpatient at a CLIP facility in Lakewood. And so this is a picture of myself carrying one box from one clinic of numerous clinics across 3 states, trying to access records so that my son could get the resources that he needed. And so I actually began my work in behavioral health about 20 years ago, before I had children, and I worked in a residential facility. I worked on the floor as a milieu counselor. I became director of the behavior management specialty program. And at that time, I never could have imagined that my own son would someday need to access the most intensive inpatient and outpatient supports that the state and nation offer. So I never envisioned myself with this box going from facility to facility, clinic to clinic, and the exhaustion that fills this box. So this box can only tell you so much looking from the outside. You know, many of us do the intakes. We're part of the intakes on the other side. We do pre-admit calls. We do the assessments. I did all of that 20 years ago. And now I've decided to return back to the field once I became aware of the parent partner position, because I believe in the power of recycling the joys and the sorrows alike that we walk through as parents, advocating with and for our children. And so now just taking the lens from working in behavioral health, and also the lens of accessing behavioral health with and for my son. I also share this picture because by the time a parent or caregiver accesses mental health services of any kind, WISE, CLIP, IEPs, any of those things, I often say those who are supporting that parent and caregiver, we don't have the luxury of meeting that parent or caregiver at their best. By the time they meet us, the level of exhaustion, the level of defeat, embarrassment. I'm actually also a stroke survivor. Some of you might know that. So I had to relearn how to walk and talk and all those things. And for years, I've been saying, stroke recovery, residual stroke recovery. And actually, I've come to realize a lot of that, what I'm experiencing, is chronic stress recovery. Chronic stress affects our cognitive functioning in great ways. And so the power of a parent partner coming alongside a team and a parent and caregiver as they're navigating the behavioral health system is powerful. So at a Common Voice COPE project, we first and foremost, like all family peers, is we hold the hope parent to parent. In this slide, you'll also see that it says family advocate to family advocate, because we also provide support and consultation and support groups for family peers employed in the behavioral health system across Washington. Family peers, or as we call them, lead parent support specialists, also strategize means of accessing the behavioral health system. We offer support in collaborating with team members. Some of you have heard me say before that we've heard and believe that parents and caregivers are the expert of their family. And I do believe that's true, but I've kind of switched it up a little bit in saying that parents and caregivers are an expert, because I believe that my son is an expert of himself and his family, and we are in need of the experts on every team that we are accessing. And so how do we work with teams? How do we hear and speak through the passion that we are experiencing as we are navigating this system? So one of the key components at a Common Voice COPE project is we are non-adversarial. We believe in working collaboratively. We also reevaluate natural supports. Many of us hear every single day about the need for respite. That is a need. And so for me, I actually denied natural supports for years and years and years, because I was afraid of my family and friends potentially seeing my son at his worst. That was a concern of mine. I was so afraid of the look in their eyes changing when they saw my son. And ultimately what that did, it robbed my son and those natural supports of opportunity, of growth. And it led to more depletion on my part. So we share in that realness with parents in reevaluating natural supports, that there might be hesitancy, there might be fear. We might feel like we've burned every bridge. Who else is there, right? And so how do we look at that again? We also reprioritize parental wellness in the midst of advocating. Something we always say is, parents, your wellness matters too in the midst of all that you're doing. And so how we do that is we offer one-on-one virtual and phone support, meeting support, so we can join parents and caregivers at virtual DDA meetings, WISE meetings, CLIP, IEPs, so Developmental Disability Administration, Wraparound Intensive Services, Children's Long-Term Inpatient, Individual Education Plan, and that list goes on and on. We also offer support groups and trainings, and some of those support groups are more regional in nature and generic, in terms of accessing the behavioral health system at large. And some of them are more specific, for instance, for parents and caregivers whose loved ones are accessing CLIP and those sorts of things. And so this slide I've kind of gone over and just saying the most important part of this is that we are non-adversarial advocates. We truly believe in working with every team and honoring the work being done by team members on WISE teams, honoring the work being done at schools, and how can we shift and grow to meet the true needs of this family and youth. So this first bullet here is really important because there are no costs to parents or caregivers. So private insurance, state insurance, no insurance, we are able to offer all of these resources to parents and caregivers. Also, youth do not have to be enrolled in mental health services for them to receive support from us, which in my own lived experience is huge, because my son's decline began quickly and rapidly at the age of 5, and he was not yet enrolled in mental health services. So when it came to accessing supports, that was a barrier. And then, of course, connecting families to relevant resources, supports, and services, emphasis on relevant. One of the themes that we are seeing here is our support during transitions and graduations into WISE, out of WISE, into CLIP, out of CLIP, during CLIP, residential schooling. And we also offer support to WISE teams. And so WISE teams can, and that's actually where a lot of our referrals come in, are from care coordinators on WISE teams, family peers on WISE teams, clinicians. And so we can join those team meetings, not to replace any one team member, but just to come alongside the effort. And again, as I mentioned, we also offer support for family peers. And I do believe this is an underutilized resource that we offer, and highly recommend you sharing or utilizing if this is applicable for you. This is a really important slide. Just quickly, what a Common Voice co-project, what we are not. We are not a crisis line. This is in part what makes us different from WISE teams. Even though we might come with our own expertise, experience, or credentials, we stay in our lane when it comes to our work with parents and caregivers. And we will refer all crises to mental health providers, WISE teams, 911 or 988. And so also, in terms of the support we offer, this is not cookie cutter. So some of the teams are parents and caregivers we support that has been going on for 2 years, 2.5 years. But by and large, our support is not intended for long-term one-on-one support. But again, we're listening for those true needs coming in and create our support based upon that. A Common Voice co-project, we follow a do for. We do not follow a do for approach, but rather a do with. We are always meant to empower parents and caregivers to advocate with rather than advocate for. And that's the heart, I believe, of all family peers, parent partners, certified peer counselors. These are some of the flyers of some of the trainings that we've done. Parent first aid, parents and caregivers wellness matters too. That's a family favorite. We did one on technology, friend or foe. We did a check engine workshop because we can be so good at checking our children's fluids under their hood, checking for their lights that are going off. But what about our escalation cycle? What about what's under our hood as a parent and caregiver, and recognizing that we have our own escalation cycle in the midst of our child's? And so really working with parents to know themselves in that way and coming alongside their child and connecting with their child in the midst of these stresses. I guess just briefly, I will say that collectively, our team has over 30 plus years professional experience with WISE as parent advocates, care coordinators, and state trainers. And then also in terms of our lived experience of accessing WISE, we have 30 plus years in terms of that. And our aim and role is to collaborate and truly partner with WISE and all teams as we empower, strengthen, and support families. In terms of referrals, I'll go ahead and give this information to Vanessa Adams. All referrals come through me, the program manager for a Common Voice co-project, and I will connect all those referrals with one of our lead parent support specialists that are spread across the state of Washington. I wanted to say in terms of when it comes to me as a parent who has had probably 5 advocates over the course of many years, I was one that was resistant. I loved the idea of parent advocates, but we as parents and caregivers often put ourselves not just on the back burner, but somewhere in the backyard, in the backwoods somewhere, right? And so finding a way to make space for us on that stove and even on a front burner. And for me, the parent partner was great. I love the idea, but finding time for my wellness was really challenging for me. And so that was a perspective shift. And so I think when you're considering, if you're new to the idea of parent partners and maybe promoting parent partners, there might be apprehension at first, and parent partners changed my life. Parent partners changed my wellness, changed how I communicate with teams across the continuum and how I advocate. And so, yeah, I think, like, as I said, coming back to the field in this capacity has been an honor of a lifetime, and coming alongside parents and caregivers. So with that, thanks for having me. If you have any questions, I'm sure my information will be given after the webinar.
Thank you so much, Jasmine. I am always honored to be in space with you, and I've seen the great work that you've done. I'm just really grateful for your partnership with Kids Mental Health Pierce County and how you show up for families. I didn't say at the beginning, but if you have questions, go ahead and put them in the Q&A or the chat, and we'll answer them at the end. The next person we're going to hear from is another phenomenal Kids Mental Health Pierce County partner and advocate, and that is Nelson Rascone from A Dad's Move.
Hello. All right, I'm going to share my screen just to go through a few slides. If it'll work. There we go. So a little bit about me. I live in Tacoma. I am a father of 3 grown children. Two of them are stepchildren with developmental disabilities, and then I have one son who has several behavioral health challenges, who I got custody of when he was 3 years old, which is what ultimately got me into this field. So we are a unique organization at Dad's Move. We consider ourselves a family-run organization, much like a Common Voice, with the twist that our focus is on fathers. We serve the whole family, but our ultimate goal is to get more father involvement, not only into the system, but into families. There's far too few of us that are working in the field as peer supports, and that is a large part of what drives the work we do. And with that kind of gets us to our history. So we were founded in 2011 by 6 of us who actually were all peer supports working in the field. Ironically, I actually worked for a Common Voice many years ago, I think about in 2008, which is how I got the passion for this. But again, I always noticed that there are not enough dads involved. I became the first male parent partner to Common Voice. I became the first male peer counselor at Catholic Community Services, and I wanted to do something to change this, as did all of us that started this group. So that's the brainchild of Dad's Move. We work with the family to get everyone involved. Kind of our motto is the old saying, it takes a village to raise a child, and unfortunately, all too often that village doesn't have the father. So that is our ultimate goal of what we're trying to accomplish. As I said, we're here to strengthen the father's role in the family. That's our first priority. Kids need their fathers, and quite frankly, moms need the help of another parent, and all too often it's just not there. As I tell people often, with our blended family, all 3 children had some significant disabilities. Matter of fact, my stepson, we had to place out of the home into a group home when he was 15. And my wife and I will celebrate 25 years of marriage next month. And that wouldn't have happened if she was having to do all of that work with 3 very high needs kids. So kids need both parents. The other thing that we try to work on is some of the barriers. Why are dads not getting involved? This has been an evolution for us. A lot of the work we do is not just with families, it's for systems change. A lot of our systems have been built around mom being the primary caregiver. So we're trying to change that. So it's not just about empowering fathers to be more involved. It's about our systems opening up to dealing with both mom and dad, and kind of looking at their services that they offer. So within that, we've started kind of changing what we do. When we first started, we were a simple father support group, the first one being in Tacoma and then the second one being in Spokane. As we've moved along, we've changed and adopted based on the work we do. Again, early on, it was the goal to get more fathers working in the system. So not seeing this really move along, we decided a few years ago to put our money where our mouth is, and we started employing our own peers in the system. So right now, we now have 7 male peers on staff. In addition to that, we actually have 5 female peers on staff, again, with the goal to try and work with the whole family to get moms and dads working together. One of the trainings we're actually in the process of developing is actually geared towards moms. How can they better engage their other halves to get them to work more collaboratively in the family together in partnership? In addition to that, we have started negotiating with the Department of Corrections to work with fathers coming out of incarceration. Because that's a huge need. A lot of them don't, again, it gets back to many of us did not have good examples as fathers, and it becomes a cycle. So we're trying to break the cycle. And in that, we're hoping to give better tools and skills to the fathers coming out of jails, and hopefully, possibly a job. One of the things we're looking at doing is growing that male peer support base. So we're hoping that some of them will get involved and work in the system. Trying to get to a specific slide here. Bear with me. So with that, we have done several things other than Department of Corrections. We have also built a peer training within our own organizations that we can use in our different programming. We have also recently been awarded by the state of Washington to be one of the peer support providers. We will begin that training probably by September. So again, this is all with the goal to get more dads plugged into the system. We also have several staff that sit on councils like the State Fatherhood Council, behavioral health councils, and we have several staff that sit on regional FSPRTs or at least participate in them. In addition to this, starting next month, we're going to start staffing a youth peer on staff that we are hoping to start plugging into the correctional system with young fathers, such as like at Green Hill. Again, trying to give them tools and supports for when they get out to hopefully they can be a fully involved father. Just like A Common Voice, our staff works one-on-one with the family. Right at the moment, we are almost equally divided between male and female. So we actually have a few families that we've received as referrals from WISE teams and other community partners, where we've been able to work with both moms and dads to try and get them on the same page. Again, we're in the process of developing trainings that are kind of geared towards that, you know, working in true partnership for parenting. Fathers need their own support. Again, this is something that was kind of obvious to us in the beginning, to those of us that started Dad's Move. Unfortunately, because we've gone so long with moms being the primary caregivers, a lot of the support was geared towards that, and moms absolutely need that support, but so do dads. And I would say they need very unique support because dads are resistant. We are a stubborn bunch, and we work to get past that, to let them know it's okay to share their emotions, their feelings, their frustrations. There's nothing wrong with it. So our bottom line is that we look at it in a wraparound model, that the whole family needs the support, both moms and dads. And quite frankly, it'll give better outcomes. If you look at a lot of our challenges with our families and even in our society right now, a lot of it traces back to no fathers. So how do we change that? And we're hoping to be kind of a part of that.
Thank you so
So-
much, Nelson.
You are welcome.
I'm so grateful that you're here. And another major component of that I've seen and seen Dads Move support is the reducing the stigma and starting those conversations just with male caregivers and men, and having that lived experience, so much experience on your team of just deep care and understanding, and having open, transparent conversations around some of those stigmatized pieces that come specific towards male caregivers. And so I appreciate you and appreciate the work that you all are doing.
Thank you.
Next and last, we are going to hear from Megan, Jordan, and Gloria from Family Behavioral Health Catholic Community Services, another great partner of Kids Mental Health Pierce County. It's really neat to hear the different connections. Nelson's done work with both. Jasmine and myself, we've all worked together so many times, so nicely, a long history. Just so grateful for all of the work you all are doing. And so last, we will hear from our Catholic Community Service friends on the work that they are doing and how peer support work is done through their organization. So Megan?
Thanks, Vanessa. I'm Megan Hauser. I'm one of the clinical managers here at Family Behavioral Health with Catholic Community Services in Pierce County. I'm just going to give a quick overview and then introduce Gloria and Jordan, who will speak on the peer perspective. We work with 3 primary programs in Pierce County. So we hold the Pierce County Crisis Line. So anytime a youth is in crisis and it goes to the crisis line, there's a potential it will go to Catholic Community Services, where we will be responding out. We also hold WISE teams as well. So most intensive at-risk youth in our community, along with FAST. The FAST program is a stabilization, so it's an up to 90-day service, and that can be for families that have state insurance and also private insurance, which is huge. So whenever a family comes into services and they do have private insurance, we always say like, hey, we have FAST, which is a great opportunity. It's just a stabilization service that is going to be a little bit faster. And so the great opportunities with the programs that we have through Family Behavioral Health is that we are able to partner with the peers and utilize the peers, which is a huge component of the services that we have. And so I would love to introduce Jordan and Gloria, who are our peer supervisors at our North End site. And they're going to speak a little bit around what their role is as a peer, how to get CPC certified, and then also how they partner with one another.
Okay. Hi, guys. Well, thanks everybody for taking the time. I'm Jordan, the youth peer supervisor, as Megan had stated. You know, I a little background about me. I'm originally from California, and you know, got out of the military. And you know, I didn't really know like what path I wanted to take. You know I wanted to work with youth, and I wanted to work with youth that were struggling. And so, you know, it kind of, you know, after digging and research, and I looked at it and was like, wow, there's this peer job, right? And that was something that I had never had as I, you know, when I was younger. And so, you know, it kind of sparked my interest. And so I've been doing this peer role for about 5 years, you know, and since, and I love every day of it. What's unique about, you know, us peers, primarily the youth peer perspective is, you know, we have experience with our, you know, our traumas, with the things that we dealt with when we were younger, things that we had to manage and overcome, you know, just whether that be the system or gang life, recovery, other childhood traumas. And so, you know, all youth peers here at CCS, you know, they all have unique backgrounds, you know, and so peers, you know, we come in with this non-traditional approach where, you know, we align ourselves with the youth. We want to know like what's going on with them, right? Where are they? What's their sense of community? You know, how do we maneuver like, you know, the traumas and the things that they're going through, and use that peer-based approach and like understanding exactly where they come from and say like, look, you know, I've been here. I've seen this before, right? This is something that I've had to deal with myself. You know, and being able to use that story and that lived experience, it kind of, you know, it motivates the youth to go, wow, you know, okay, well, like you know, you did this, I can totally do this as well, right? And it's like, absolutely you can. There's no reason why you can't. And so, you know, again, you know, all of our peers, they all have different unique backgrounds, and depending on their backgrounds, you know, it just helps them maneuver and help out and find like what the youth is trying to communicate or what needs they're having that maybe they're struggling with, and all the peers are certified. They're all certified peer counselors that have been through the training. In order to be a peer counselor, you do have to go through the 40-hour requirement training, as well as pass a written exam followed by a oral evaluation. You can access this through the peer pathway or through the peer support website. Also, I think Healthcare Authority also has it. But all of our peers have been through the training, and it just is a way to test them on their ability to use that experience to motivate and advocate and support with the family and with the youths. We, again, as peers, we have a very unique perspective on like how to maneuver systems and how to maneuver things that, challenges that they may be dealing with. And so with that, we get really creative. Peers meet them where they're at, no matter what time. I've had experiences where I meet them at the skate parks that they like to go to. I meet them at a random bus stop that for some reason that's their favorite bus stop. Out parks, communities, libraries, you name it. We're going to meet them there because we want to understand who they are. What are the challenges and struggles that they're going through. In order to find this, we've got to kind of understand who they are and what needs they're having. Also, peers, we kind of challenge them in a way where we work alongside the clinical team and learning new skills, learning new hobbies. Maybe they're struggling with, finding a sense of community. So peers that we get out there and we help them, like, okay, cool, let's check this park out. You're struggling with friends, let's talk about this. Maybe let's kind of role play this scenario a little bit and see, maybe we can go out and find some friends, right? Or you like skateboarding, we can start checking out skate parks. We've been as creative as like helping them build ramps or build different projects, to get them like a sense of independence, teaching them how to maneuver the bus systems or, transportation and budgeting and just all the logistical things in life, right? And so, that's a unique thing that here at CCS we do. We also contribute, we, have helped or do help with, youth that are in crisis, that are at Mary Bridge Hospital. And it just is a way to kind of come in and again, use that lived experience and say, hey, I've been here too, man. Like, I understand, like, I get it. Like, this does suck, but let's talk about this. Cause this doesn't have to be where, where you're at right now. This isn't it. And so, again, all the peers, just very experienced, and just using that shared lived experience to align themselves up with the youth and support, and just make sure like they know that they are being heard, that they're being advocated with and for, and that we're capturing their needs and their wants. Gloria?
Hey. Hi, everyone. My name is Gloria Henderson. I am the parent peer supervisor at our office. And a little background about myself. I have 4 children, actually. My 3 boys when I was first divorced, challenging times, challenging behaviors, some of the times not knowing whether the next day was going to bring joy, unhappiness, but just kind of navigating. I actually worked for another mental health agency with adults, but I was looking for something to do differently and saw a job description for a peer. And of course, my first thought was, wow, there's a position that, it's a job. Because for me, it was just kind of navigating day-to-day life, and that's what I did and worked. So applied for this job, amazing. One of the things I think when I had my interview was, what can I give back to another parent so they don't have to go through what I went through? If I can just help one parent, and it's actually more than supporting just one parent, but I think for our parent peer services, a lot of times when families are coming into maybe one of the hospitals, and that is, I feel like, one of the most vulnerable times for a parent. They don't know what's going on with their child. They're overwhelmed, they're stressed out, and we can provide parent support that will just kind of show up, be there with the clinician or with the youth peer, and provide that listening ear, just listening, just really listening, not asking a lot of questions, just being there in the moment with that parent so that they can share what they're feeling, how they're feeling. And then it's a lot of times just providing a lot of validation, really just meeting them where they're at in a moment. And so with our parent peers at our office, very similar to what Jordan shared, we're working with the clinical team. We always want to make sure that that parent's voice is heard. If there's something that they're not understanding, we are there to kind of, I say, break it down in a more parent-friendly perspective, empowering that parent, this is services that are for you and your family. Our families are voice and choice, family voice and choice. So you can speak up. It's okay to share what you need to share. It's okay to, talk with the clinician about what you'd like to see for your family. And then we're just doing a great job of supporting the parents. A lot of times I know, especially in our crisis and fast, the parent peers are sharing Jasmine's services with the Common Voice, and we're actually sharing Nelson's Dad's Move, because it is very important that parents are supported and that they're having that kind of sustainability after they transition out of our services. I know there's a lot of information, it sounds like, that's been given about the family partners and parent partners. And so very much the same for our office. We are doing those same exact things that the other two agencies are doing. And then, it was nice that Jordan was able to give a little bit of perspective on the youth peer and kind of what they offer.
Right. And I'll throw in there too, Gloria. One thing I missed is, we as peers, as the youth peers using this lived experience is, helping the youth create goals that are created by them and for them. Right. And ensuring like, hey, like, this is your goal, right? I'm here to help you with it. Let's make it happen. And so it's trying to capture the goals and the needs that the youth has. That's, as a peer, is like one of our biggest focuses is just helping them, again, where they are, hearing them, understanding them, and then knowing how to maneuver some of the things that they're going through. Also, I didn't add in there was the rapport building, part of that rapport building, and like, getting the trust and, establishing that positive connection to making them more open and, susceptible to like saying, hey, like, I'm okay with talking to you now. As peers, we try to get in as establish a very positive relationship with the youth, to where they see us as somebody that they can lean on, someone that they can confide in, and that they trust. Youth peers, myself, we definitely just try to, make sure they know, like, that we are here for them and that we are going to help them through this with them. You know what I mean? Like, we're going to be alongside them, not in front of them, not behind them, but right next to you, tackling the goals that you want to tackle alongside the other teams and other agencies we partner with. And so, just as a youth peer, and that perspective we have is just, it's very unique, and it is proven to be highly effective. Youth absolutely love the idea that we can meet them where they are. They kind of, honestly kind of trip out a little bit, and they're like, whoa, wow, you can go to the skate park with me, dude, and like see my friends. I'm like, absolutely, man, let's go, show me where your favorite spots are. And, then we just kind of gather information and talk to them, and, just let them know, again, I'm here for you, man. Let's do this. You can do it. You got this team behind you. I'm with you. Let's make it happen.
Thank you all so much for sharing, Jordan. Absolutely. And I was an emergency department social worker for a very long time, as many of you may know, before transitioning into this role. And what you spoke of around being able to meet at Marybridge or being able to partner with youth at Marybridge has been so effective. I definitely have seen youth very resistant to other folks, medical social workers, other people, like, why are you why? What do you know about anything? And really the efficacy of just having a peer come in and be like, and instill hope, like, hey, I have lived, or I have experienced, or I recognize, and just being able to show up for them where they're at in one of the potentially hardest moments of their lives, and instill that hope has been just absolutely inspiring to me. I witnessed it for many, many years, and in very creative ways. So absolutely can speak to how effective and impactful that was in so many places and situations. And in the same vein, for parents too, I sat in the middle of the night, and the first person that a parent would be connected to was their parent partner, that they'd been working with. They don't necessarily know or trust a brand new face of a brand new place, but they've built that rapport. They've built that established connection of understanding, respect, and connection with their parent partner as well. And so just that additional component of a care team is just so important and so impactful. So very grateful and thankful for the peers that have shown up in the middle of the night, or at the skate park, or once a week until someone left the hospital. So very, very appreciative from a professional perspective, but also from a human perspective for those young people. I do not see any questions in the chat from anyone. If you do have one, please add it. I do have a question. Jasmine added how to get a hold of her or how to make a referral to a Common Voice co-project. Nelson, would you like to add or speak to how someone would make a referral to you to a dad's move?
Yes, I'll put my 2 emails in the chat right now, but I will throw in there in about 2 weeks. We're gonna have our referral form on the website. We've been kind of doing a bunch of stuff in the back end, so that we'll have multiple ways of getting referrals to us.
Great, that is wonderful. I'm always happy to help connect. I know how to track down these folks as well. So if anyone wants to reach out through kidsmentalhealthpiercecounty.org or shoot me an email at vanessa.adams@multicare.org, I can always help connect or find ways to connect to the best place and space. Megan, do you want to speak at all to how folks would connect to services through Catholic Community Services?
Yeah, absolutely. So anyone can refer into Catholic Community Services. Of course, depending on insurance would be what direction you would go. With that being said, we always ask if someone is referring in, make sure that the family is aware. We're not going to cold call a family and be like, hey, it sounds like you need services. I want to give them dignity and respect that they have, that they are aware. But they would call, I can put it in the chat, our front desk number, and they would be connected to one of our access specialists who would start that referral process to see what is the most appropriate service for them.
Wonderful. Thank you. I do not see any questions that have popped up. I do see Nelson has added some email addresses in the chat there. I'm happy to share them out after the webinar as well. Again, just very grateful to all the work that you are all doing to support youth and families here in Pierce County and in our community, working together to better support our young folks. Thank you all for attending. Thank you all for watching and recorded. This will be recorded on the website to be shared out wherever folks need it. And again, just the value of parent and peers, I cannot stress enough the impact that it's made on the young folks I've worked with. So thankful for you all for being here to share this information and work in our community. So thank you all for attending. Thank you all for participating, and you are appreciated.
Thank you. Great to see all of you. Thank you, everybody.
Thank you.
Thank you.